Welcome to the Burkes Oral Surgery Sit-Down, conversations with the leaders in oral and dental implant surgery in Berks County. Each episode provides insight into what we do at Burkes Oral Surgery and Dental Implant Center.
Welcome to the first episode of the BOS Sit-Down. Have you ever wanted to get information from your doctor but didn't know what to ask? Or wanted some information before setting up a visit or a consult? Well, this is the podcast for you. Each episode will discuss a topic to help demystify oral surgery and provide you with valuable information to help you achieve your oral health goals. In this episode, we'll give you a background into Burkes Oral Surgery and Dental Implant Center, as well as a conversation about what an oral surgeon is and what they do every day. Hello, my name is Mark Luckenbill, and I'm here today with Dr. Geoffrey Zinberg of Burkes Oral Surgery. Why don't you tell us a little bit about Burkes Oral Surgery?
Hey, thanks, Mark. So, Burkes Oral Surgery is an oral surgery office, a practice that's centered here in Berks County. It's been around for just over 40 years, probably going on 43 years now. And we have prided ourselves on the treatment and care of our neighbors, the people in our community, and providing top-shelf, top-notch care in oral surgery, and really just excellent, well-rounded care in dental implant surgery as well.
And how many locations do you guys have?
We have 3 offices. Our main office is in Wyomissing behind the Berkshire Mall. We have an Exeter location on Perkiomen Avenue, pretty much in the center of Exeter, and then we have an office in Hamburg as well.
Now, are the same doctors at all those offices?
Pretty much, yeah.
So you guys have the whole area pretty well covered.
We try to, yeah, absolutely. We want to serve all of our neighbors and fellow Berks Countyans.
Well, that's great. Why don't you explain to us what is an OMS? What does that stand for?
So OMS means oral and maxillofacial surgeon. I know that maxillofacial can be a tough word sometimes to hear, but or even say. But essentially, I am and my partners are dentists, doctors who specialize in the surgical management of diseases or conditions of the face, jaw, mouth, and really the whole, what we call the maxillofacial complex. So the upper jaw, the lower jaw, and everything that it surrounds.
How long did you have to go to school for this? How long did it take you?
After college, which was 4 years of undergraduate study, I went to dental school for 4 years. I personally went to Temple Dental School, but there are over 50 dental schools across the country. Dental school is also 4 years, and then following that, an oral surgeon will go to at least 4 years of oral surgery hospital training. So essentially, it's a residency training, just like most medical school doctors will do. They go to a hospital and work there for 3 to 4 to 5 to beyond years, getting training, working directly with patients in the hospital. And that's what oral surgeons do. So we work in the hospital for 4 years, doing a lot of oral surgery, but also doing other rotations. So we rotate and do several months with the anesthesia service, working essentially as an anesthesiologist, putting people to sleep, waking them up for different types of surgery. We rotate with the medicine services, so working with internists to manage the variety of medical conditions that people will suffer from. Things like diabetes or lung disease or heart disease. We'll be managing a lot of those things, just like our medical doctor colleagues during our residency training. And then we work with the general surgery team as well, helping with their trauma patients or even doing procedures like gallbladder removal or appendix removals. We will work in close-knit with the general surgeons as well.
Oh, okay. So do you guys work on rotation with the Reading Hospital as well?
Yes, yeah. So once we finished all of our residencies and we came to the area, and I came to this area back in 2015, I started to be on staff at the Reading Hospital, and several times a year I will take a call through the Reading Hospital. So if there's a patient who needs an oral surgeon, I'm the person that they call. My partner, same thing, and we're there to help people who are in dire need of emergent and urgent care in a hospital setting.
How many doctors do you have on staff at Burkes Oral Surgery?
There are 6 of us currently.
Wow, that's a lot.
Yeah, we're one of the larger group practices in Pennsylvania. And again, allows us the opportunity to take care of a lot of people who need the specialty care that we're able to provide.
Well, that's great. I know you get this next question a lot. Do you do dental cleanings?
That is a question I get a lot. Do I do cleanings? Do I do fillings? Those types of things. I haven't done that since I was in dental school. So once I finished my training in dental school and went on to residency training, it really became primarily surgical. So no, I don't do cleanings. I don't do fillings. I don't do crowns. I don't do root canals. We work with general dentists and specialists in other areas who do those procedures to be part of the overall dental care team.
Why would my dentist recommend that I see an oral surgeon? Why would I need to see you?
The primary reason is you need to have some type of surgery. So the majority of what I do on a day-to-day basis is oral surgery procedures. So the most common thing is the removal of a tooth. Someone comes in, they've got a broken tooth or a tooth that's painful, and that tooth needs to be removed, and that's been prescribed or treatment planned and decided that it needs to be done by your dentist, and you come to see me to have the tooth removed. The other things that we'll do are removal of third molars, which are wisdom teeth, which we'll talk about, I think, in a future episode. The other things that we do are dental implant placement, bone grafting to allow for dental implant placement. We are able to provide general anesthesia for patients who have some nerves about a procedure or are concerned, which is really a huge help for us to be able to provide that service for people who are anxious or concerned, or for, let's say, a procedure is going to be a little bit more than they want to tolerate under local anesthesia. We're able to provide that. So really the reason that you would come to see me is you need to have a surgical procedure. And as a surgeon, we're the best people who are trained to handle a wide array, if not all, oral surgery procedures, and certainly any of the things that might come up as a surprise either during or after the procedure to help manage those things.
Now, if I need to see you, or I think I need to see you, should I go through my dentist first, or should I give you guys a call and see if I can set up a consult?
A lot of times it's best to go through your dentist, and the reason is because our goal for treatment is to manage you as a whole. And so if you have a tooth that's broken and obviously needs to come out, certainly you could call us right away. But if you go through your dentist, they're able to look at your whole mouth, determine what teeth are in good shape, what teeth aren't in good shape, and if there's more than one tooth that needs to be removed, or maybe this tooth could be saved with a root canal and a large filling, then that's going to be in your best interest. Certainly, if you're experiencing pain, swelling, the tooth is very broken down, we are very happy to get you in to take care of whatever urgent problem there may be. And I would say a lot of our patients do that. We do see a lot of people who come and are referred by themselves directly to us, and we're able to provide that care in an expedited and efficient manner.
If my dentist recommends that I need to see an oral surgeon, is that something I should be worried about? Or is that common practice for a dentist to refer me to a specialist in certain situations?
That's a great question. And a lot of people do have a fear of dentists in general. And certainly when they think about having to have surgery, there's going to be some additional fear. What's wrong? Why is this a problem that I need to see an oral surgeon for? And it's not necessarily the case. Like you said, there are dentists who may be comfortable with doing certain procedures, but we are the specialists in oral surgery. We are the ones who manage and take care of these types of problems on a day-to-day, hour-to-hour basis for years and years and sometimes decades. Not to pat ourselves on the back, but we're the best at it because of that experience that we have.
Well, that looks like a good introduction into what you do as an oral surgeon. In upcoming episodes, we'll cover specific topics in oral surgery and have a lot more information that our listeners and future patients can use to achieve their oral health goals.
Thanks, Mark.
Thanks, Jeff.
Thank you so much for listening. We hope that this episode was educational and helpful in the pursuit of your goals. If it was, please like and share with your friends and family, and follow us on Facebook and Instagram at Burkes Oral Surgery and on Twitter at BurkesOS. Visit our website at burkesoralsurgery.com and look for other episodes on YouTube channel Burkes Oral Surgery and Dental Implant Center. While this podcast provides a wide range of information about oral surgery, it cannot and does not serve as individualized medical advice. Should you have questions about anything you have heard on this show, becoming a patient at Burkes Oral Surgery is only a phone call away at 610-374-4093.